Good morning, good afternoon, good evening, depending on where you're coming from. It's very good to see. I see some names I recognize in the our participant list here. In the chat, feel free to go ahead and throw in where you're calling in from or where you're logging in from. I like to see all the different places. So thanks for joining me today. We're going to be talking about advancing triage excellence. Hello, Florida. All right. So, today's agenda, we're going to go over what is triage, our triage portfolio, NTEP for those of you who are new to what is NTEP, and then at the end we'll get to some questions and answers. As Nan said, you can also feel free to throw in some questions in the chat if anything comes up. Let's see who we have. We have South Carolina. Hey, Alan. We also have Nebraska joining, Pennsylvania, Washington. Cool, cool. All over the place. Massachusetts. Nice. Excellent. Okay. So why don't we get started? When we talk about triage, we're talking about one of the most foundational processes in emergency care. Triage helps ensure that limited emergency department resources, right? We want to make sure that we are allocating the right staff, the beds, the equipment, everything is being appropriately triaged so that the sickest patients are seen and treated first. It's a dynamic, rapid decision-making process that requires both clinical expertise and sound judgment. When it's done well, triage promotes patient safety, improves flow, and helps prevent delays in time-sensitive interventions and time-sensitive interventions. So, how well do we actually perform triage? In the chat, before I give away the answer here, I really want to know, what do you think? Um, how accurate, percentage-wise, do you think nurses are in assigning an ESI level? So 0 to 100%. I want to see it in the chat. 40%, 50, 60, 75, 40, 45. Okay. 60, 60, 40. Okay. So everyone's kind of around that same idea. Most of you are pretty on it. We are accurate 50 to 80% of the time. So what we've noticed is a research suggests that triage accuracy rates vary widely, 50 to 80%. Can you imagine? Like, I was just traveling. We were out in Billings, Montana, doing some stuff for our residency program. And if I got on that plane and the pilot or the flight attendant said, we are about 50 to 80% accurate in landing this plane, I don't think I would get on that plane, right? So it's just crazy to me to think that we're okay with this and we're not okay with it, right? Which is why we've created a standardized approach to triage education. So we know that some hospitals have developed their own homegrown education. And what we're finding is that there's still gaps that are missing in the education. So what we've come to the conclusion that it's really important to standardize how we're learning how to triage, what we're learning, and consistently evaluating the education to ensure that it's matching what the current state of triage and what are the potential gaps, right? So in 2024, ENA conducted a study to better understand what knowledge, skills, attitudes, and abilities are essential for effective triage practice. Our goal was to move beyond the assumptions and get to the core of what makes triage nurse safe, effective, and confident in their role. So the findings, as you can see over here, it was they were pretty clear. There are gaps in triage competency, right? Not everybody is taught the same thing. What is the standard approach to teaching them? Who's teaching? What are their qualifications? So there's a lot of different components that come behind of, what makes somebody competent. So the specific areas where we find nurses struggle is making sound clinical decisions under pressure. I mean, that's a no-brainer, right? We all know that we experience this all the time. Rapid patient assessment. So to have to do it quickly, maintaining awareness of multiple patients simultaneously. I think, I want to see in the chat who here has worked in triage. You could put, Yes, no, not yet, but want to. We all know that those are real problems that we face all the time. And no matter how experienced you are, it's difficult to manage the environment as well. So yes, I see a lot of people here who are involved in triage who have done triage themselves. And one of the other things is making fast yet accurate triage assignment, right? The one piece that we tend to forget, and I don't know that all homegrown programs dive into this, is the communication piece with families, with patients, with visitors. So these findings reaffirm why ENA developed an evidence-based standardized triage education. So we can address these gaps systematically and empower triage nurses at every stage of their development. So we want to make sure that every ED nurse who's trained with the same education. So we're all approaching triage the same way and improving our accuracy. Before I jump into that course that we created based on the research, I want to go over some of what we offer as far as our education. Okay, so right here, let's start on the left-hand side. So on the left-hand side, we have updated ESI 3.0. That I kind of consider that more of our entry-level option. So it is a self-paced online course that's focused exclusively on the ESI algorithm. So this is a solid introduction to ESI, the Emergency Severity Index, and includes 5 hours of CE. This is something all nurses should be taking, right? We know that there are nurses who may not go out in triage or haven't been trained to go out in triage, but they're still assigning an ESI at the bedside when they get an ambulance or, when something like that happens. So they should be familiar with what that algorithm is and how to use that. This is also great for a refresher or for even more experienced nurses who haven't gone and taken this course and haven't been refreshed on it. So anyone who isn't familiar with what ESI is, this would be a great place to start. Then you have in the middle right there, triage curriculum. The course dives deeper into triage by combining the ESI content with structured triage education concepts. So we have ethics, you go into legal issues like EMTALA. We dive into more special populations, pediatrics, geriatrics, the pregnant patients. So that's also self-paced and it is also online. This is a good fit for those nurses who want more in-depth understanding of triage, both like the theoretical grounding and all of the issues that are surrounding the triage environment. This is for definitely somebody who's also triaging, whether they're out in triage or triaging at the bedside. The cool thing is it's also right now it serves as our pre-course work for the next under the purple section, which is NTEP. So for those of you who have already taken triage curriculum recently, you're halfway there to getting your NTEP. So you really would just need to then take NTEP. So some people stop with triage curriculum, and that's where we took it the step further. So I don't think that just taking triage curriculum in itself is enough. I really do think that every nurse would benefit from stepping into triage should be taking NTEP. So NTEP, it is offered hybrid, so it is both delivered virtually and in person. As I mentioned before, triage curriculum serves as the pre-course material. Upon successful completion of NTEP, you will get a 4-year verification card, very similar to TNCC and EMPC. It is our most comprehensive solution for emergency nursing triage competency. With this course, you'll earn 22 CE, and it helps to confirm and validate triage readiness and clinical competence. So it helps prepare you to actually being out there in the triage environment and handling the triage role, just beyond, ESI assignment. For all the leaders that are here on the call today, NTEP provides you with a really defensible, standardized method to evaluate triage skills and increase confidence at triage points. It helps to reduce the risk and strengthen patient safety. So if you're looking to build a culture of triage excellence in your emergency department, NTEP is that solution that really checks that box. Again, the recording of this webinar will be available afterwards if there's anything that you want to review. All right, so the next thing I'm going to hop into is course updates. Our board of directors is in today, and they're just walking by, so pardon the interruption, but wanted to say hi. Okay, so our Emergency Severity Index 3.0. This course was redesigned to deliver a more integrated and modern learning experience. We often hear from people, and everyone was asking whether or not, did you guys update the manual? Is that why you updated the course? No, we continuously update our courses so that we want to keep it up to date with modern learning experience as well. So the handbook, the ESI handbook, has not been updated, and that's not the reason why we updated the ESI course. So what we did is we ended up including the pediatric triage content into, thank you. We updated the pediatric content, and that course is going to be eliminated because we've already included the pediatric component into the ESI course. So it's not going to be offered separate. I can field any questions anyone may have at the end if you have questions about the pediatric ESI course. So what we thought of is like everybody should understand the concept of how ESI applies to adults and pediatrics. We shouldn't have the gap. There are some that might say, well, I only work in a pediatric emergency department. I never see an adult. I would actually, probably say you do see adults, they're just not registered as patients. So when mom or dad passes out or caregiver passes out or something happens, there are visitors, there are different patients that come in with different caregivers of all ages. I think it is important for us as emergency nurses to know how to take care of, how to assess those patients, regardless of whether those are the only patient populations that you see. Um, I mean, the same argument could be said as I've never seen somebody with sickle cell. Why should I educate myself with that? It's because you never know, right? And it may come, that patient population may present at any time. So what we did for the ESI course is that we updated it to make it, we used a different learning management platform to build it in. It's called Rise. So it improves the user ability and accessibility, and it's more mobile compatible if you choose to, take the course on your iPad or something like that. So those enhancements allow learners to progress through the content a little bit more intuitively. We're working currently on translations of ESI, including Spanish, Polish, and German, which we anticipate to be completed by the end of Q2 or beginning of Q3. If you're interested in those languages, you can always reach out to us as well to give you more quicker updates on those. All right, so the next course is our Triage Curriculum 2.0. Formerly just called Triage Curriculum. This we updated primarily improving the learner experience while also maintaining the integrity of the previous course. So some of the content changes were minimal. We wanted to, as many of you might know, American Heart Association had a couple of updates. We wanted to make sure our pediatric content within the module 2 were vital signs were updated. We updated some of the majority of our reference materials and any of the materials that were supporting the evidence to ensure that it was aligned with best practices. I think the most notable revision on Triage Curriculum was the addition of audio narration throughout the RISE modules. I, for one, am an audible learner, so to be able to kind of put in an earbud and listen along to it helps me retain the information. So it also helps people to engage a little bit differently with their learning materials. So one of the other things is we want to be inclusive as well and ensure that we're providing accessibility to all different types of learners. All right. The next is the NTEP, which is our new triage verification course. NTEP began in June of last year and has been evolving very quickly from a triage course into what we're now calling a comprehensive program. because it really supports competency validation, implementation, and quality improvement in triage practice across emergency departments. It integrates learning components, including pre-course work, as I mentioned earlier, didactic education, practice scenarios, and competency development and evaluation to support nurses throughout their professional practice. So from novice to experts. I like to say that NTEP isn't just another educational course. The reason why we find it to be more of a program is that it's the result of the direct input from the field and our internal research. Based on what we had discovered or uncovered, I should say, that staff nurses and nurse managers alike consistently are reporting that triage training and evaluation is inconsistent. And I said earlier, notably, many triage nurses told us that they receive far less training than and fewer formal competency evaluations compared to what their managers believe is actually happening, or compared to what is actually being offered to them. So they may have only been trained in triage one time and never again has it been re-looked at or reevaluated. So it really it brings us to a critical point where there seems to be a disconnect between what's being delivered and what nurses actually really need when it comes time to the preparation. So the gap isn't really theoretical. It directly affects the practice at our bedside. And so these consequences can be serious, right? We know mistakes in triage assessments can lead to preventable harm, missed or even delayed care, patient deaths, and a significant emotional strain on the nurses that are the ones having to make these decisions. So this gives more importance to why we call this a program and why we develop NTEP. We want this to become the national model to ensure that there's consistency across all hospitals, right, and health systems. So that is our goal for NTEP. So I'm going to dive into what is NTEP here and like the different components. Like TNCC and EMPC, NTEP is a day-and-a-half class. The day one, you can see here, we focus on building strong clinical foundation. So you would have come to class already, have done your triage curriculum modules, and then ready to dive into your core triage concepts, decision making using the ESI algorithm, effective assessment and questioning techniques. We dive into special patient population. Pediatrics is also included in there. Realistic triage scenarios. And I think probably one of the most important differences that I notice with NTEP is that we really focus on critical thinking in a high pressure triage environments. Then you go away and you absorb everything that's learned. And in day two, we start diving into documentation best practices and how to support your acuity decisions. We dive into communication strategies, including how to manage the triage room, how to manage the family experience and the patient experience. We talk about self-care techniques for the triage nurse, and then we do some skill practicing. Followed by that is our sort of our skill station testing, where we use simulation. So there is a written exam and there is that skill station demonstration of competency for triage, where they are giving a simulated scenario. Learners are given 2 attempts at both skill and the written exam, and upon successful completion, they will receive 22 contact hours and a triage verification card that is valid for 4 years, which you can see here is an example on the right-hand side. The verification card gives hospitals a tangible, defensible way to confirm that a nurse has been trained and is competent in triage, which I think is really sorely missing today in most hospitals. All right, so the skill station kind of looks like this. Obviously, we're not going to put any of the information because we don't want to reveal any of the testing stuff. But as part of the verification process, learners participate in a realistic scenario-based assessment designed to evaluate real triage decision making. So what you're seeing here is a simulation environment where learners are presented with the patient avatars here and clinical presentations. We've so you can't see the testing scenario, the questions there, but the question would be there and some of the information. So based on the information that's provided to the learner, they must select an ESI level appropriate for the patients that are presenting. So this station is designed to kind of replicate these pressures and nuances that you may experience in the ED waiting room, and it challenges the nurse to quickly assess and synthesize the symptoms, apply the ESI algorithm, and make strong clinical judgment. So I think what really sets NTEP apart is that it isn't just a theoretical exercise. We validate the skills-based assessment in doing the simulation component. So we're hoping to ensure that nurses who take this aren't just learning how to triage, but they're seeing it and they're actually applying it and simulating the what it is to be in that triage decision-making role. All right, so how do you take an NTEP provider course? Curious, who here has actually gone through NTEP and taken it? So I want to put that in the chat. You can just say me, I have, whatever. I just want to see how many people have taken it. So for those that are interested in taking it, you can scan that QR code. It'll take you to our Triage landing page where you can see the available courses. It is offered virtually. You can attend, there's different time starts for the courses. We do have some courses that are night shift, and you scan the QR code, or you can visit ena.org at /NTEP. You'll have a list of all the classes that are available. Click the link for your preferred date that the class is offered, and be sure to note on the registration link whether or not it is in live or live or in person, if it is delivered live or if it is virtual. And then make sure you complete your pre-course modules prior to class. Like TNCC and EMPC, if your pre-course materials aren't completed before class, you will not be able to enter. All right, so everybody, it's almost the question came before, how do I become an NTEP provider? Everyone is like, ooh, this is really cool. How do I teach this? Well, how do you become an instructor is first take the NTEP provider course. Then to reach instructor potential, like TNCC, we modeled it to the same format, is you must score 90% or higher on the first attempt. And that is both for your skill station and for the exam. So I think that's one of the things people forget here. And I want to remind you, you need to score 90% or higher on your first attempt to be considered as an instructor potential. So once you have taken the class, and let's say, because you guys are all brilliant, you've scored 92%, you will automatically get an email congratulating you on accomplishing that big feat, and you'll be sent a survey, and we will work with you to get you a list of instructor courses, which I'll get to in a second. You register and attend an NTEP instructor course. You'll get the course material from ENA, and then you would then observe a course scheduled to be monitored in teaching a course, and then you would be able to teach independently. Any questions you can put in the chat. One of the things I also wanted to mention is if you're interested in taking, let me go back one slide so I can show you this. So say, yes, I'm interested as an individual and I want to take it, go ahead and scan that. I'll give you a link at the end. If you're thinking, for leaders on the call as well, I really want my entire staff to be taking this, we can do that as well. We can either, depending on how you would like it delivered, whether you want it virtually delivered, we can put your staff in a class or work on getting them all into classes together, or we could, ENA does come out to hospitals and deliver the course at your hospital. And that would go through our business development partners, which I'll give you a link to. Um, Here is, so the instructor piece here. All right. So talking about the instructor courses, it is currently in development. Amy Toops, who's on the call with us today, or the webinar, she's also manning the chat. So if you have questions specifically about the NTEP instructor course, you can ping her as well. The observed class, to answer, I just looked at the chat briefly. The observed class can be virtual, yes. So the instructor class specifically, so you've taken the provider course and now you want to learn how to be an instructor. That is currently in development. We are estimating our launch to be the end of June. We are beginning our pilots in April. We have our dates scheduled for those pilots. So anybody who has taken NTEP since it started in June up until now, we will be identifying those people who have instructor potential and offering them an opportunity to participate in the pilots. So courses will be offered for the instructor course, both virtually and in person. We're thinking, because it is a pilot and we're still testing out the material, we're thinking the instructor course may be about 6 to 8 hours. I almost put 6, 7 in there for those of you who have children around my age, my child's age. 6, 7. I couldn't get away with doing that. Okay. So we're actually thinking it's going to be between 6 and 8 hours in length. You will get a verification card upon completing the instructor course, and you'll also be awarded CE. Other specific questions we may not be able to answer right away since the course is in development, but if there are questions that do come up, we're happy to walk you through what that might look like or what your answers are. So I think I gave a pretty good outlook of all of our triage portfolio. If there are hospitals or health systems that are looking to bring NTEP to your hospital, we would love to talk to you. We would love to come out and teach this and see see which of our contracted nurses and nurses who work here would love to come out there and teach the NTEP course. So you can scan the QR code, or you can also reach out to our group sales at ena.org if you're looking to have NTEP come to your hospital. With that, I think here is the link if anyone was looking to see the research that was done by Dr. Wolf and team. So you can access the material there. And I'll go back to this slide. So I am open to taking questions. If there's anything, Amy, if you want to come off, or Nan want to come
Yeah.
off and see if there's
So
questions.
I figured this question would be easier answered live rather than in the chat. If a hospital system already uses ENA triage modules, will they be updated to this new format? If so, when?
Okay, so there are a couple types of, I guess I need more, uh,
Information.
yes, because if they're referring to the Elsevier triage, those are converting over to triage curriculum. If they're talking about the ESI course, I think I probably need more information to be able to answer that one. Maybe let's email them offline and find out
Or
exactly what.
see, hey, Anita, if you can provide some
Oh,
additional information of what triage modules in particular you're referencing, that would be great. And then there was a question in the chat. Do you have a recommendation on how long an RN should have a triage assignment on a shift? I am assuming the accuracy of assigning ESI and asking thorough questions go down the longer that the RN is triaging, 4 hour versus 12-hour shift.
yeah. Well, ENA doesn't have a recommendation on that since we're not a regulatory body. There is plenty of research out there that you can look at that tells you how long, when you have cognitive overload that you can look at. As far as when should a nurse be ready or how much time before it there's a couple of things. One, our position statement says that the qualifications for triage should be a minimum of a year before you go out there. Now, We understand that given the situation of staffing and challenges like that, we have seen nurses with 6 months right under their belt being put out in triage. Um, while I don't think that it's ideal, nor would that support what we say in our position statement, but if they are going to be out there, then I would want them to have the most comprehensive triage training to be able to be prepared out there. Oh, Janet, I took the NTEP program a few weeks ago. Most excellent. Awesome. We love hearing that feedback. Anything
There's
else?
another question in the chat. What ratio of in-person versus virtual NTEP courses do you anticipate being held in the next year?
What ratio? We are running looking this way because I have a calendar there. We are running on average 2 to 3 courses a week. We are working with the Veterans Affairs hospitals, and they are all getting trained in NTEP. So to answer the question, what percentage? I don't know if I have a specific percentage, but we're trying to get at least one course a week up on the calendars. They do fill up fast. We max out on our virtual classes. We don't typically like to have more than 14, 15 max in a virtual setting because it's we want to focus on the learner engagement piece and the testing. For each of the classes that we do run, we have 2 instructors that are there, and then we do run a 1 to 6 ratio with testing as well. So we may have more instructors on the second day. I would say to continuously look at the NTEP landing page to see when the classes are available. They do fill up fast. And then we're trying to quickly catch up with that as well. A recommendation would probably be if you and a group of people from your ED are interested, I would reach out to our group sales and then this way we can get you a scheduled course for your location. Any other questions, Amy? I'm trying to scroll through the chat as well. Hoping to get Qatar. Yes, we're hoping to get Qatar converted over as well. Would love to do disseminate NTEP internationally. All right. Hi, Brian. I see Brian Rogers is on. Hi, Brian. Will you be sending recording? Yes, we'll be recording this and it'll be placed on our NTEP landing page as well. Any other questions?
There's a question asking if the new updates include information skill building on managing a very full waiting room. This is the part that we always have to add into ENA modules now. We can't speak, so sorry. We routinely have large volumes.
Yes. We talk about managing the patient, the triage waiting room. We also talk about nurse safety as well, and that's a component of NTEP. Mhm. Can the observed class be virtual? Yes. I'm assuming I think I answered that one when I was talking, but yes. Most our instructors that have gone through our piloting that we've done, they have been virtually observed. If a hospital uses our ENA triage modules, oh, that was will they be updated to the new format? If so, when? Anita, is that Anita Bennett? I will, if I know what state you're from, I can have one of our group sales team reach out to you, kind of take a look at what your health system currently has, and then be able to answer that question. Well, we would love to hear from you. We would love to come out and teach NTEP at your hospital. So please reach out to us. You can contact group sales at ena.org and we will figure out how to get NTEP to your hospital. Or if you're an individual and want to register yourself, you can scan the QR code and take a look at the list of classes that are available. All right. I will let everybody have their time back then. Thank you so much, everyone, for your time and attention. Appreciate you.